So thyroid disease is defined as any dysfunction of the butterfly-shaped gland that is at the base of the neck that's called the thyroid. There are a multitude of abnormal thyroid complications, but the most commonly seen that we're going to talk about are the hypothyroidism and hyperthyroidism. Hypothyroidism is the decrease in circulating levels of the thyroid hormone. Severe hypothyroidism is known as myxedema, and it can be caused by a multitude of things, but Hashimoto disease is the most common cause of this. It can also be caused by thyroid gland surgery, anti-thyroid drugs, and so forth. Hyperthyroidism, on the other hand, is the elevated thyroid function that causes for an excess in the secretion of the thyroid hormones, and it's most commonly caused by an autoimmune disease that's called Graves' disease. It can be caused by genetic and immunologic factors or thyroid cancer as well. So in regard to the pathophysiology of these, in regard to hypothyroidism, it is broken down into primary and secondary hypothyroidism. In primary hypothyroidism, the TH production decrease is a result of the loss of thyroid tissue, thus causing an increased secretion of the thyroid stimulating hormone, which leads to goiter. In secondary hypothyroidism, the pituitary doesn't secrete an adequate amount of TSH and it may progress to myxedema. In regard to hyperthyroidism, it increases the metabolic rate, which leads to an increased production and increased cardiac activity. And so whenever the cause is Graves' disease, the thyroid stimulating antibodies bind to and stimulate the thyroid stimulating hormone receptors. And the trigger for this autoimmune disease is honestly unclear at this time, but it's associated with the production of autoantibodies. In regard to some expected clinical manifestations, hypothyroidism might present with a slight mental slowing, a dry tongue that is also thick, a hoarseness to the voice, speech that is slow and slurred, skin that is dry and flaky as well as non-elastic. The hands and feet would probably be puffy as well as the face. There would be drooping underneath the eyelids. The hair would be dry and patchy, and also patchy with its hair loss as well. There would be a loss of the outer third of the eyebrow. There would be an intention tremor, weak pulses, bradycardia, hypothermia, decreased systolic pressure with an increased diastolic pressure, absent or decreased bowel sounds, and a doughy skin that feels cool to the touch. But on the opposite side of hyperthyroidism, it presents with physical findings such as an enlarged but a slightly firm thyroid that's called a goiter, periorbital edema with Graves' disease, tremor of the hands and fingers, skin that is flushed but is also smooth and warm. You would expect to find diaphoresis, hair that is soft and brittle but it's also fine. You would see premature graying and an increased amount of hair loss. You would see skin that is thickened. You would see tachycardia at rest. You would find bounding pulses, arrhythmias, a wide pulse pressure, hyperactive bowel sounds, weakness, and possibly generalized or localized paralysis depending on the extent of this.
So these illustrations are something that I found to better understand the manifestations that you might find with hypo or hyperthyroidism. So in the first one that we're going to talk about is hyperthyroidism, and you see here that, this person is sitting there holding a fan because they have an intolerance to heat. And, as they are holding the fan, their fingers are showing clubbing, and they're showing some tremors and stuff too while trying to hold up the fan. But that fan is blowing back fine, straight hair. You can tell that their eyes are bulging out. Their face is flushed. They have an enlarged thyroid. They're experiencing tachycardia. They have an increased systolic blood pressure. Their breasts might be enlarged, and then you notice there on the pants that they have a pin holding up the waist of the pants because they're experiencing weight loss. They would have muscle wasting, and then at the bottom of the pants you notice that they're kind of poofy, and that shows the localized edema. And then there could also be menstrual changes and an increased amount of diarrhea because the overactive bowel sounds. So on the other end of this, there's hypothyroidism, and as you can see here, this guy's pretty bundled up because he's experiencing an intolerance to the cold. And underneath his earmuffs, you can see that there's a receding hairline there. His eyes and face are experiencing edema, so there's facial and eyelid edema underneath the eyes there that you can see. There's a dull, blank expression to his face. He's experiencing extreme fatigue, has a thick tongue that has slowed and slurred speech. probably experiencing anorexia. The brittle nails and hair are also a manifestation of this. There would be menstrual disturbances, probably experiencing constipation due to the underactive or absent bowel sounds. There would be muscle ache and weakness. The skin would be coarse and scaly, which you can see why he has a bottle of body lotion there to be able to assist with that. You know, he would also be experiencing hair loss and just be generalized like tired. And then at the bottom there you can see that there are the late clinical manifestations, which would be a lower body temperature. They would be experiencing bradycardia. There would be an amount of weight gain. There would be a decreased level of consciousness because, you know, again, the mixed edema coma, and then, you know, the thickened skin, and there will be cardiac complications as well.
In regard to the diagnostics and the testing for this disease, for hypothyroidism, a radioimmunoassay would show the decreased levels of the T3 and the T4. The thyroid stimulating hormone level would increase with the thyroid insufficiency, and it would decrease with the pituitary insufficiency. Sodium levels would show low levels with those that are experiencing a mixed edema coma. The CBC would maybe identify anemia, and ABG would also show a decreased pH and an increased partial pressure of the carbon dioxide in those who are experiencing that coma. A skull radiography, a CT scan, or an MRI might be conducted to show the pituitary or the hypothalamic lesions that might be present. In regard to hyperthyroidism, the thyroid stimulating hormone level is decreased. Thyroid autoantibody titers are elevated whenever Graves' disease is the cause of this. A thyroid scan and a radioactive iodine uptake test would show an increased uptake of the radioactive iodine, which is indicated as an increased production of thyroxine. A radioimmunoassay shows the T3 and the T4 levels would be increased, but the T3 level would be a greater increase than what the T4 increase would be. And lastly, an electrocardiogram might be conducted to confirm if the patient is also experiencing sinus tachycardia or atrial fibrillation with this. There are a multitude of complications that might arise from this disease, but two of the more significant ones to address would be the thyroid storm, which is also known as the thyrotoxic crisis, and it's a life-threatening condition in which hyperthyroidism is untreated or it is undertreated. It can occur due to a major stress to the body, like a trauma. It can occur because of a heart attack, or it can occur in an infection with those who have uncontrolled or undermanaged hyperthyroidism. In regard to the mixed edema coma, it is an extreme case of untreated or undertreated hypothyroidism that might occur. It decreases the patient's mental status and causes hypothermia, as well as other conditions that would slow the multiple functions of organs. And this is also considered to be a medical emergency.
So again, mixed edema coma is a life-threatening condition that occurs whenever hypothyroidism is untreated, whenever a stressor such as an acute illness, injury, chemo, or discontinuing a thyroid replacement therapy affects a client who has hypothyroidism. And with that, some manifestations that you might expect to see would be respiratory failure, hypotension, hypothermia, bradycardia and dysrhythmias, hyponatremia, hypoglycemia, and a coma.
In regard to the National League of Nursing's competency, nursing judgment is something that really should be used within this situation to observe the severity of the complications that this disease might cause, whether it be on one end of hypothyroidism or on the other end of hyperthyroidism. So by using these skills and the knowledge that's obtained through nursing school and throughout a nursing career, the nurse should be able to use this information to best understand the problem, the issues, or any concerns that the patient might have for their condition, and be able to respond to them in an appropriate manner. And so assessments should be done holistically by using critical thinking to best move forward with the patient's care in order to prevent complications like, the coma or the crisis from happening. By using nursing judgment and frequently assessing the situation, the nurse will better be able to overall improve the outcome of the patient's care and be able to ultimately take care of them in the best possible manner for this disease process.